Community health nurses across the country have today begun an indefinite strike. They are protesting what they describe as unfair treatment, discrimination, and disrespect they receive from the Health Ministry and the Nursing and Midwifery Council. Esther Banfo, the national president of the Community Health Nurse Association of Ghana, joins me in the studio for more on the story. Thank you, Esther, for joining us this afternoon on the program.
Thank you, dear.
First, tell us why you say that it's important that all your members lay down their tools. Why?
Thank you. We are saying it is important they lay down their tools because we have problems.
What are your problems?
We have a lot of problems, but the two major ones are: one, NMC, that is the Nursing and Midwifery Council, that is our regulatory body, is saying that they are changing our name from community health nurse to nurse assistant, which we think we will not agree to that because it is a total demotion, it is a reduce in rank, and two, it also causes or send us at a disadvantageous side in many aspects. Talk of the condition of service now we are talking about with the government or we have signed pact with. We don't have a place in that condition of service. Two, now we fought for career progression, which even that one we talk about.
Okay, sorry, before you talk about the two, the one when you say that you do not have a say in your conditions of service, are you saying you don't have some right now?
There is nothing like that in the condition of service calling that this place is for nurse assistant or nurse assistant is entitled to this or they'll benefit from A, B, C, D. No. There again, if we should agree, it means we are no more nurses because there are some nurses somewhere and we are assisting them. But practically, it is not so. I don't know whether you know much into community health nursing. Wherever you go in this country, apart from the big cities or towns, you don't see a community health nurse working under anybody. They do everything on their own. So we don't see why they should call.
So per your training, the Medical and Dental Council or the Nursing and Midwifery Council certified all of you to be nurses.
Yes.
And then you are categorized into community health nurses. That
Yes.
is, you run all the CHIPS compounds in Ghana.
Yes.
Right. So did the Nursing and Midwifery Council give you a letter telling you that as of today or as of tomorrow, you are now nursing assistants?
No, please. For we as an association or nurses, no.
So what is feeding your decision to go on a strike?
What is feeding us is that we know that if such a decision was to be taken, there should be much stakeholders consultation.
Has that decision been taken?
By the change of name?
Yes.
They have, as we are speaking. Personally, I have a lot of certificates my people have forwarded to me. And interestingly, I have lost my certificate. When I even went to take it, they gave me registered enrollers. What is happening at the council there? I have a lot. And one interesting thing is that I'm your mate. Today I will go for my certificate. They will give me nurse assistant. Tomorrow you go, they will give you nurse assistant preventive. Another time, another person will go registered nurse assistant preventive. So the system is in Yama. We don't know what is happening.
No, so if you don't understand what's happening, what is the proper channel? You are the president of an association.
Yes.
Have you sat down to ask the Nurse and Midwifery Council questions about why all of this is happening?
Yes, we have done that. We heard rumors and we told ourselves it is not true. Because if anything of such is going to happen, they will consult us or they will tell us. So we waited until one day at my own facility, I saw a circular. So when I saw the circular, there and then I called my secretary.
A circular from where?
From NMC, with an attachment from our regional chief nursing officer. And then they circulated it to the sub-district.
Saying that what?
Saying that from this day, 2013 downwards, all those who have completed community nursing, they are going to change their name and giving them nurse assistant certificate.
Are you saying the council doesn't have the power to do that?
For me, I can't say yes or no, because I know they are under Ministry of Health.
Yes.
And even if they have the power, it is a decision that is going to affect somebody. So at least consultation should have been done.
So you're saying that they've taken a decision which was without consultation, but you cannot say whether or not they have the legal rights to do so or not.
They are under Ministry of Health.
And they have the right to take such a decision.
Such decisions.
So if they do have the right to take such a decision, and you've done your consultation, you didn't get any response, your last resort is to deprive all of us of health resources and go on a strike?
Not that. Our training is in two phases. Or let me say, when we are buying the form, it is the Ministry of Health that sells the forms to us. I saw community health nursing training and I wanted to go into that. So I bought the form that is sending me to community health nursing training school. I write my exam, you license me or you register me as a community health nurse. So why is it that if you are issuing a certificate, you issue a nurse assistant certificate? So we don't know what is happening, because I bought the form that I'm attending community health nursing. So at the end of it all, if it is community health nursing training I'm attending, I'm expecting that after the training you give me community nursing certificate. So why do you give me nurse assistant certificate? That is where the understanding is also not coming. And if you are regulating us and there is that disparities, at least you have to inform us. Or there should be a forum. Oh, because of reason A, B, C, D, we are your regulators and we have the powers to do everything. Because of that, from today, you are no more called this. We are going to change your name to this. Who are we to say no?
Is that not what has happened?
No. And let me tell you that even after the first press conference last year and went to the minister's office, the minister stepped in. It was there that we got to know that the ministry itself wasn't aware. We are coming from various parts of the country. Some at the regional levels, district level. The question everybody is asking is, why the need? Why should they do that?
Okay, so
most people weren't consulted.
Right, so you've taken this decision to go on a strike. How many of you make up the association? How many of you?
Oh, we are over 13,000 now.
Over 13,000.
Yes.
What will your strike do to healthcare delivery in this country now?
Well, as you are aware,
what will be the impact?
As you are aware, we are all over the country, especially at the remote areas, the CHIPS compound and what have you. And we are doing everything. It's of late that they have joined us, and not even everywhere, with some of enrolled nurses. But they are purely into clinicals, and we do both. We can do clinical. Before then, we were doing both. So now that we are not there, it's not going to be easy. Most of the places, they have closed the CHIPS compound. So imagine somebody falls sick, whether small ailment or whatever. We are not there to attend to them.
Okay.
We give immunization against the killer diseases. If you are not there, nobody will do it.
Do you appreciate that the service you provide is an essential one?
Yes, very.
Do you know that if a pregnant woman in a remote area today walks to a CHIPS compound, it's closed, she has complications, and unfortunately she dies as a result, they can require that of your hand, that you have caused this?
Requiring from my hands, but first it had to go to our superiors.
No, but you took a decision not to work and close down the CHIPS compound.
But the doctors also went and nobody asked that.
Does that make it right?
It's not right, but then in Ghana, we have dialogue for far too long. We didn't want this thing to happen. And even now, my people will call and tell us, hey, madam, they are bribing you. They are sending you abroad here and there. They are buying you cars to cruise in. That is why you don't want to talk for us.
Is it true?
It is not true. And I told them that I don't believe in fighting or whatever. I believe in dialogue. But the dialoguing is for far too long. This change of name alone, we started last year, November. And up to today, nothing concrete has been done.
Did you inform the National Labour Commission about your decision to go on a strike?
The National Labour Commission? Yeah, the commission, there is one place we sent a letter to. I don't know whether that is the commission or the Labour. Yes, we have one of our letters with one of the Labour people.
No, give me clarity. Did you send communication to the National Labour Commission saying that you've taken this decision, you've withdrawn your services? Because you need to give them notice before you take such a decision.
Okay, for now, let me say no.
You did not. You did not. Do you realize the magnitude of what you're doing? The lives at stake here?
Well,
you don't care.
Hey, I care.
Do you? Because you have withdrawn your services.
Oh, we went
care,
somewhere.
You won't, would you?
We were doing some monitoring. We went somewhere. The mothers were there, and they were even saying that, madam, we support you people.
Are you sure?
Yes, but those people who were there, myself and my team, we decided to attend to them.
But if you care and you know that your decision not to work affects the lives of people, you would be measured with this one, wouldn't you?
That's why we are saying that we didn't want this thing to happen. But we've talked about it for far too long. Those who are doing that to us, they are not on the field. So this is the time that we want to let them know that we also matter. So they should also think they are not thinking about us.
How many lives should be sacrificed for you to make this point?
How many?
How many lives?
Well, in our case, not much, because we are not doctors who maybe 20.
But you say that you run healthcare delivery in the remotest parts of this country.
Yes.
You know that your job you do is important for that old person or that young person in that very remote part of this country? Why would you deprive them of your service if you could go to the table and negotiate and have this done properly?
That's why I'm saying that the table, we've been to the table for far too long and nothing is happening. Nothing is happening. Okay,
so now you've withdrawn your services. What do you want and how soon do you want it?
We want our name to be reversed for now. We are just on the name. We have other issues. We want our name to be reversed back to community health nursing. And two, just recently, we worked on our fair wages. We worked on our salary, job reevaluation. And it is assist, whereas we don't assist. And after everything that we did, we were told that irrespective of what we write, if we are saying that we command heaven to come down, they are not going to leave our job description out. So meaning, irrespective of what we are doing, that thing is going to still put us at the disadvantageous side. So even we want that job description to be changed. And the airline that they quoted.
Did you sign on to what they showed you initially?
Which one?
Of the assistant you speak of in your condition.
In fact, that one I came to meet it.
So if you came to meet it and it has been signed, why do you want to overturn everything?
Oh, but we progress, we don't retrogress. And things are changing.
What is changing?
For them, they are even saying that they are talking about international standard, they want to move forward. So why should we remain the same? We also have to go forward. We need to broaden our scope of knowledge and we need to get somewhere. So if they started by saying that we are to assist some people and now we are no more assisting, that thing should be off. And you know, in Ghana, today maybe I am here or I'm the only one who have risen to a certain point and I'm not thinking about. I'm thinking about what will happen in future to the younger ones. Some people, when they get to a position, tomorrow they are no more there. Maybe I become somebody else. I don't think what will happen. So there's no need for me to look at what is happening and make changes or whatever. Okay?
Are you choosing this timing to ask for all these things because we are in an election year?
Oh, that one dear, no. For me, this strike, if I tell you I love it, or my people, my team, no. Otherwise, we would have called for it a long time ago. Why is it that last year, November, we didn't declare? We thought that was somehow going to be a threat so that they will speed up things. Let me tell you, oh, my brother, we've talked about this for far too long ago. And it is not because it is an election year that we want to do this. No. But we are saying that if we told the minister to write to NMC to halt them until we find a lasting solution to this one. If they had done that, we wouldn't have been going on strike. But still, even as at yesterday, and from last week or so, they are still inaugurating nurse assistant, doing everything, still issuing out the certificate. That's why we are saying no. Then we have to come in at this time. So it's not because of election year, that's why we are doing that.
So if you decide for all these things you're asking for, if they are not given to you and government hypothetically says, okay, you can go. You've gone on strike, you can go. We don't want you back. What would you do?
And it won't happen like that.
Because?
The government, he knows our value.
So are you strong-arming them because you know they know your value?
No, not that we are strong-arming them. But they can't say we should go just like that. We have a case. Listen to us. And as a father, come to our aid. Find a way of solving the problem for us once and for all than to tell us to go.
So with the withdrawal of these services, have you petitioned the health ministry?
Oh, yes. Before yesterday, in fact, as I told you, series of meetings has been held. And minister gave us ultimately 3 weeks to come back for feedback.
Which is when?
Oh, I've forgotten. It's about over 2 months now. And we don't meet him. So about a month ago, we also wrote another letter telling them that by 31st of May, if they don't attend to our needs, we will embark on strike. And nobody called us, nobody attended to us. That is why we are saying that, okay, because we were thinking that between those times, they will call us and say, what do you think we should do for you? Or we dialogue and then we suggest things to them. But nobody called us until yesterday, so we had to. And we cannot, today we have to strike today, so we had to go on air yesterday.
And this is an indefinite strike. We don't know when you come back.
No.
Are you glad staying home, not working?
Pardon me?
Are you glad taking the decision to go home and
I'm not glad. For me, if I stay in the house, I can't sleep, I can't do anything. So I love going to work, but half for there is nothing I can do.
All right, Esther, thank you for joining us this afternoon here on the program. As you heard, community health nurses have withdrawn their services, so that will mean that for many of the CHIPS compounds across the country, they will not be working. You wouldn't find any health official there to provide you the care you require. That's difficult. Let's see how the Health Ministry and the Nursing and Midwifery Council deals with this matter, so we get closure on it and we have these nurses return to work. Well, there's also good news for us all. Another strike that we knew of. There's been some progress in the industrial dispute between the Judicial Service staff and governments. They have been on strike for the past 2 weeks over what they say is government's failure to implement the consolidation of salaries and allowances for its members more than a year after their request was forwarded to government. JUSAG at a news conference says it will soon bring to an end the 2-week-long strike which has crippled activities at the courts. We can now speak to Kwabna Osuamprechum, who was at that news conference. He joins me now on the line. Kwabna, when JUSAG says they've made progress, what exactly do they mean? Are they calling it off immediately? Kwabna, can you hear me?
Yes, I can hear you, Francis.
I'm asking, when JUSAG says they've made progress, what is it? Have they called off their strike?
No, Francis, they haven't exactly called off the strike, but they've been very careful in their choice of words. What their leader, Nesnati, is saying is they've been able to have some good progress with government on negotiating their salaries. They've also been talking about the fact that they want their consolidated salaries paid. They are directed at certain level and also some allowances. And they are saying that so far negotiations are better than what we saw previously. You know, earlier they were fighting with the Employment and Labor Ministry over a lot of issues. A lot of them have been settled, and now they have actually, according to them, is left with some few issues to settle. As we speak now, they are in Parliament to meet the minister and a section of some ministers as well as some parliamentarians to try and iron out the whole issue. So they are saying that they've not confirmed it, but hopefully after this meeting, when they have assurances that the issues they've raised will all be settled to their satisfaction, then possibly they could call up the strike, Francis.
And when will that be, Amprechum? Because I know for many who are watching, they're asking, okay, press conference, progress being made, but bottom line is what? When are they calling off the strike so we can all go back and have court activities resume?
That is actually a question they will not answer. But from their indication and posture, when you speak with them, they seem very optimistic that the meeting they are having currently, they are in the meeting right now, they will speak to us after the meeting. They gave a positive indication that it is possible it could resolve it, but it's still unclear whether they will be satisfied with the assurances given. But I think this is the first time something concessionary has been coming from JUSAG. For the first time, they are saying they could call off their strike. You know, they've been calling the bluff of the Labour Ministry, even the national, NLC, which took them to court, they've been calling their bluff. But now they are saying themselves they could soon come to a settlement. And so it is better than the position they've been keeping. So hopefully, after this meeting, they'll come up with something positive. But we can't be assured of that unless they tell us, Francis.
Okay, so it means we will have to keep an eye on that meeting ongoing between JUSAG and the Employment and Labour Ministry to see whether the strike by JUSAG will be called off or not. One strike in, another seemingly going out. Community health nurses have withdrawn their services today, but JUSAG is currently in a meeting with government to try and iron out all those issues relating to their conditions. We'll see how that plays out in the coming hours. We'll go for a break. When we come back, another issue on the table. Political parties are dealing with a deadline today, the small political parties, to satisfy requirements to keep them in operation. We'll bring you details after the break as to who has met this deadline and who hasn't. Stay with us.